Okay, hello there. My name's Ben. I'm a 7-year firefighter paramedic, and I was diagnosed with a ruptured L5S1 disc that protruded onto the right sciatic nerve. I believe it's the S1 nerve that runs down the back of the leg. So for 3 months, I've been kind of experiencing some progress, but overall constant pain, like dagger-like pain into the butt, cheek, and the calf. I have an earlier video that kind of just discussed a little bit of what I've experienced along the way, and at the time I was 12 weeks in almost 13 of trying to treat it with just physical therapy and chiropractics and deep tissue laser, class 4 laser, dry needling, just kind of throwing everything at it that I could. I was able to tolerate quite a few different activities comfortably, and they all seemed to kind of help the progress. But the progress ultimately just started to taper off even after my second epidural steroid shot, which did bring me some relief, but I still was left looking for ibuprofen and some sort of anti-inflammatories to keep that nerve pain a little more manageable, because it was never gone, and at times it was only annoying, but other times it was really difficult to manage. So uh, after the steroid shot, I did meet with my neurosurgeon, and I was able to talk to him as well as a couple PAs, physician's assistants, about my symptoms relating back to my MRI, and just try to get a picture, like, am I gonna find healing, true healing, non-surgically? How long am I gonna have to wait this out? Because all the while I've been just working light duty, unable to lift patients, go on calls, all that kind of stuff. So my ultimate goal is to get as healthy as I can with this injury, knowing it's going to be a lifelong thing to cope with, to deal with, and to learn from, but something that I can use to, I believe, make myself stronger and smarter. So I want to get back to being fully capable firefighter, and I want to get back to being a competitive run and A racer, mountain bike racer, and just general have fun outside and pick up my 8-month-old without having to do it properly, or at least do it in a safe way and not be worried about what's going to happen if I don't. So the neurosurgeon basically told me, you're probably going to need 3 years, if that, to end up being sciatic symptom free. With the way my injury was, the disc was still attached, and so the body wasn't really trying to reseal the disc. It was trying to just make it all one big fat disc, which meant it was going to constantly be pressuring that nerve. So I didn't need much talking into at that point. Dealing with that pain for 3 months, people have dealt with it for years, 9 months, all that, and I wanted to get back to my lifestyle, and I was willing to take the risks that go along with surgery. So they scheduled surgery literally 3 days after my consultation. I had 2 last days of trying to enjoy the amazing summer we have, and went into surgery this morning and went under anesthetics. Came out super emotional. That was kind of weird, but I could feel a good deal of pain and pressure. Kind of felt like I likened it to like a snake's fangs just sunk right into my low back, kind of both sides, and just kind of that throbby feel. But it was not bad, and I couldn't really tell if I had sciatic pain any longer after that, because that pain was pretty distracting, and I was really just laying down and on pain meds, and not able to really test it to see, because really all I needed to do was do any sort of a forward fold, and I could get that nerve to scream at me. I'm not going to do any forward folds right now. I have at least 3 weeks of very mellow living, no bending, no twisting, no lifting anything over 10 pounds. So I did get the clearance to hold my little 8-month-old boy, and I'm really excited about that. But even that, I am so paranoid that I do not want to re-injure this disc, because what they found out, they thought, you know, it was going to be something I could be back to work within almost 8 weeks. When he got in there, there was a lot of the nucleus pulposa, the center, they call it crab meat, is kind of the consistency that had that was out in that space, and so it took him a while to get in there and get all of that out. From the right side, it was all the way back towards the center as well, and what I'm left with is a disc that is just wide open right now, and so I don't want to push anything else out. The nerve, they were able to free it, but it took a lot of tugging and actually manipulation to free the nerve, which I think is why I'm feeling some more pain in my back right now. But I don't have any numbness or tingling. I've got compression socks on. I feel really good standing and walking, relatively speaking, for having had a surgery where you go completely under and then you come back. I've been laying down and just getting up and walking for 10 minutes every hour or so. I'm tired, I look probably medicated, but overall I feel a lot of relief knowing that at this point, even though I have a wide open disc, I think that I can safely work with that over the next 8 weeks of really no activity. I think maybe after 6 weeks I'll get the clear to start doing some core. I went into the surgery with probably the strongest core I've ever done, because I just was hitting the physical therapy so hard and just really trying to break through with that, and I didn't, and my therapist agreed, and other friends agreed that are professionals in healthcare, that at 13 weeks I was still really symptomatic. Then I'm probably a good candidate for surgery if I want to get back to being sciatic pain free. I have to deal with the tightness of a scar tissue in there and a disc that, you know, will obviously be less voluminous, have a little less of the ability to do its job, but that's why I'll just continue to strengthen everything around it and lift a lot smarter every day at work, as well as just being good with lifting bikes onto vehicles, whatever it is. So surgery, 6 hours out of it, really happy that I get to start the progress. I'll continue to upload some videos. I just want to, if somebody else is in this scenario and they're torn as to whether they want to go surgical or non-surgical, whether they're a firefighter or someone who needs to use their body for their work, I wanted to give them something to work with, because I've just had so many questions through this whole process and so many unknowns, and for me, I've been very patient to wait this long to try to alleviate the pain, and ultimately I'm not willing to be patient for 3 years. So that's kind of what that sport study suggests, is almost all patients with a ruptured disc at 3 years are in a similar ballpark, but surgical patients get there much sooner. I think the benefit of me trying to go non-surgical is it really has trained my body to do a lot of different mechanics, and it's wizened me to how to strengthen the area around it to try to relieve and unload pressure from that disc. So even though it would be sweet to be back to work right now, if I would have just dove into surgery, I would have always guessed, could I have gone, you know, non-surgical and been healed? Could it, you know, just having those questions in my mind. Plus I wouldn't have taken the time to learn along the way just how important mechanics are and everything. So I'll keep you updated. I'm curious to see what the next visit with the doctor. I didn't get a chance, you know, in surgery you don't get a ton of time to really talk with a doctor, because that would be the one thing I'd really like to ask more questions from him about. But in the meanwhile, I'm paranoid. I am going to log roll. I am not going to bend over. I will keep on the pain meds, because they really do keep you away from just dwelling on the incisional pain in the back. But I can already tell that This is something that's a lot easier to deal with than the sciatica because it's predictable, it's part of the healing process, whereas sciatica is really just part of nerve irritation over and over and over again. All right? Good luck.